Hi, welcome to Mad Medicine with Miss P. That's me. A couple fun things I've got for you today. And, the irony is, I thought maybe when I was done with all of my papers that I've been collecting over the years of fabulous things patients and students and doctors and nurses say that I would be done. But it keeps rolling in. I have another full page at work that I'm filling in rather quickly. As long as I'm in this position that I'm working in at work, I don't know that this will ever necessarily stop. I know I may never get to the other videos I was planning on doing because I can't let this stuff go. It's good stuff. For instance, this patient, for instance, this patient came in to have a epidermal injection. I know I get that quite a bit. The old epidermal, in your back. Or what they call a back injection. And I said, okay, well, where in your back? And they go, well, in my spine. I go, that's fortunate because, that's what's back there. But could you be more specific? I'm trying to get some sort of thoracic, cervical, lumbar, give me something. And they're like, it's an epidural. I'm like, okay, again, that's good. Where? And then that's when they, again, tell me their spine, which is fortunate because that's where your epidural space is, near the spine area. But you're never going to get them to, once in a blue moon, will somebody who's probably had 400 injections know exactly, what to say to where I can verify what we're doing. But most people just say shot in my back, which I was like, okay, could you be more vague? No, it's impossible. Okay, just checking. That's fine. And then it took me a while to figure out with this one patient. He said he had MRSA. I don't know if he said in my stomach or on my stomach, but we always have to say, have you ever had MRSA? And if so, there's a little bit of a protocol we need to complete depending on what procedure they're having. So he said it was in my stomach. I'm like, okay, so I'm thinking like, are we talking, a systemic gastrointestinal issue? Was this, a septic thing? Like, where exactly when we say stomach? And then after what felt like forever questioning, he meant it was just on his skin, on his abdomen. Like he had a cut or a scrape or something that ended up being MRSA on his abdomen. Surely he doesn't know the difference of what that means to a medical professional when you say the difference between your stomach and your abdomen. You all know that's not the same thing, right? And I know people say it all the time. Just yesterday, oh, you want me to roll over onto my stomach? Like, well, and no more than I want you to roll over onto your pancreas, liver, intestines. You mean your abdomen or belly? Or whatever you want to call it. But I don't know. I'll never understand why stomach has somehow over the years referred to just your front side. Like it's not supine or prone. They just say stomach. Like that's just anatomy. That's not a position. So it turns out it was just in his skin. Anyway, oh God, this one I almost added this on last week because I didn't want to leave it behind. It was so fabulous. Did I add it on? I don't think so. That's how short my memory is. We have to ask everybody, have you ever smoked cigarettes? Not do you currently smoke, but also have you ever smoked? There's a box for never smoked, current, or former. So then I said, do you drink alcohol? I'm like, no, I don't drink any alcohol. Like never at all, not once a week or anything like that. No. Well, I drink wine. Wine is alcoholic. There's no 8-year-old having a glass of wine with dinner. No 14-year-old boy sits down and is like, Mom, can you pour me a glass of wine? You can have milk because wine's alcohol. Then she said, I shit you not. She said, well, some people don't consider wine alcohol. Who are those people? Alcoholics? Wine is alcohol. If you drink wine every day, that's alcohol. If you can get drunk on it, it's alcoholic. Oh, well, I just didn't know if you considered it. Yes, I personally consider an alcoholic beverage alcohol. Bless her. And it's just they can't. I guess because I can't drink at all. One drink, I'm toast. I'm not even kidding. Ask anybody. It's sad. It's sad. I'm not even an adult. One drink and I'm down. That's why my husband married me. I'm pretty sure. But when I ask if people drink alcohol, they'll say like, well, socially. And I say, okay, is that, one a day, one a week, one a month? And they're like, oh, maybe 3 or 4 times a week. That's not socially. That is consistently. Like, I don't do anything 3 or 4 times a week. I shower maybe, I shower every day. Wash my hair maybe 3 or 4 times a week. That's not occasionally. That's pretty consistent. You drink alcohol. That's not socially. Are you having friends over 3 to 4 times a week? That's what socially. Social means when you're in a social event. If you're doing it, this one guy told me yesterday, 5 times a week. You're thinking, no, 5 a day, he said. I drink maybe about 5 beers a day. Okay, you're a functioning alcoholic then. That's 5 beers a day. And then we have to have them stop for 48 hours. He's going to be in friggin' DTs by post-op. That's not socially. You're an alcoholic. Oh. I can't even read my own darn writing. My students know that. See if I can come back to that. Maybe it says, I think this patient had COPD but not asthma. If you have emphysema, I don't care if you have asthma. You're going to die of emphysema. Doesn't make a difference if you have asthma. That's not a thing. This other patient, and they can't figure out what surgery is. It doesn't matter how many times I say, like, what surgery did you had? And they'll say, like, oh, I had the cancer surgery. That's not a thing. Or they're like, well, I had endometriosis. Did you have a hysterectomy or a uterine ablation? And then yesterday she was like, no, they weren't in the uterus. They were like outside of it. They were outside your endometrium, looking for endometriosis. Okay, and not that there's not some, traveling, but turns out she had a pelvic laparoscopy, and it took me a while to get that out of her, and I don't even know if that's true. But this patient said that they had x-rays for the cancer. Bone cancer maybe, because that's what x-rays show. X-rays show bone. They don't show soft tissue. I mean, sometimes, like, I can tell if your colon is full when I'm taking x-rays, but that's the x-rays for cancer. Those are MRIs, PET scans, that sort of thing, but the old cancer x-rays. And then this other patient said that they were allergic to a medication because it put me into hepatitis. Put you right on in there. You went into the hepatitis room, did you? It put me into hepatitis. And most of these they're writing these down themselves. They're typing it in themselves. That's how they do. Oh, and the alcohol. Here's another alcohol one. For whatever reason, on our type-in, you can type in daily, weekly, monthly, yearly, or as needed. Alcohol as needed. So that's what they put in there. And I don't remember the number, but they put as needed. I think this says 6. So if they put 6 in there and they wrote as needed, when I call and verify, I say, well, what's as needed? Per week. 6 per week. You mean daily? That's basically daily, but that's fine. Oh, yes. This is one that really burns me, something fierce. They can't, and there's a couple doctors that are pretty good at this, but on average, your surgeons are not the ones putting you to sleep. You know that, right? You doctors and nurses out there, you know that your surgeon is not putting you to sleep. That's your anesthesiologist, your nurse anesthetist, a nurse anesthetist. So when the patient tells me that the surgeon says, well, he told me to take this and this and this before surgery, and I have to say, no, don't do any of that. That is not what the anesthesiologist wants. This is what the anesthesiologist wants you to take. This is what you hold, this is what you take, and this is why. But these people insist that the surgeon told me. The surgeon's not putting you to sleep. So I strongly advise you to listen to the anesthesiologist that needs these medications to work with your anesthesia, not against it. But the surgeon said, yeah, the surgeon's going to cut you up and mess with your insides and close you back up. If you so much as go into cardiac arrest, he's going to leave the room and pee himself after dictating, and then we're going to be in there saving your life. Not the surgeon. The surgeon literally is going to sew you up as quickly as they can and get you stable so they can get out of there. They're not putting you to sleep. Quit asking a surgeon what to do. And honestly, the anesthesiologist, remember what I said before, they're in the gunshot wound, they're in the heart transplant, they're in the umbilical hernia repair. They've seen it all. Those are the guys you want to listen to. Those are the ladies, those are the gentlemen, those are the people you want to listen to. They know what's going on. And if one more person charts or types in there, charts, like a patient charts, that they had their gallbladder removed under local, I want to see that. The local gallbladder removal. Maybe it's possible. And sedation versus general anesthesia, I've said that before. Nobody understands that at all. Like, not even a little bit. You won't believe the things they think you're going to do under general, and then the things that they think they can have under sedation or local. Oh, colon resection under, yeah. One of this patients charted that they had a colon resection under monitored anesthesia care. Again, I can't even fathom what that would sound like. A lot of screaming, I assume. Oh, I think I already did. Okay, I think I did this side. Yes, I think I already did this side. Yes, which was fabulous. That started with the left knee laparoscopy. You know, the laparoscopic left knee, looking around. Maybe the muscle, I don't know, the left knee. Oh, and getting the med list. This is one of my favorite things. When you get someone's med list, I take metformin. Not a word. He means metformin, but still, that's just as good. How much? 2 tabs. That's not a dose. Like, that could range between 1,000 milligrams difference, if not more than that. So you have to fight. How much is the dose? 1 tablet, but he told me to take 2. Right, and how much is that? That's 2 twice a day. Right, but how much is that? Well, 4 total. For the love of God, look at the bottle and give me a number that is followed by mg. You can't get it. Oh yes, this one patient told me he took 400 milligrams of Cardizem. Oh my God, that's a pretty hefty dose. And because I know my dose is, after doing this for 100 years, I've seen 90, and that's like 90 twice a day, more for blood pressure than necessarily, AFib or anything like that. 180 once a day, or sometimes even twice a day. I think I've seen 240, usually just once a day. 400 I've never seen. So the more we continue to do this and then look through some of the other doses, he's given me some other wild doses, like doses I've never really heard of. And as I'm typing it, I thought, I think I know what's going on. Yes, this was a 420-pound gentleman. That's why those doses are that high, which makes perfect sense. If you're bigger, you need more. If you're smaller, you need less. But I had to put 2 and 2 together there, because I almost thought I was going to question, the numbers he's reading me off the bottles. And then, I don't know if it was him or another one, but they don't take magnesium oxide. They take magnesium oxidized. It's where the magnesium changes color, oxidizes. Like after you dye your hair and the tips turn colors. It's magnesium oxidized. That's what they typed in there. Oh, the meniscus disc. Yes, the patient had the surgery. She put in their meniscus disc. I don't know if they mean, are we talking about our back or our knee? Meniscus disc. That's not a thing, but all right. It's still interesting either way. And this patient was having a DCR, the dacrocystal rhinostomy, because the tear duct was clogged, which, is normal, except this duct quacks. Your duct, there's no quacking. It's not a duck. It's a duct. Tear duct quacks. Another patient was telling me that they use their inhaler, for their sinuses. Do you inhale it through your nose? Because the other inhaler goes into your lungs. It really can't, there's no way of making it get to your sinuses, no matter how talented you are. I don't think that's how that works. And I'm going to end this with this after this last question. We ask every patient if you have anything removable in your mouth, partial plates, caps, crowns, anything you remove before going to bed. And she said, well, I've had a breast dog. Okay, don't take those out. We're going to leave them in for surgery. I was wondering if there's anything removable from your mouth, not from your chest. She literally said that she had a breast aug when asked if anything was removable. We don't take those out for surgery. Sometimes dentures, definitely contacts, piercings, implants, not so much. No matter where the implant is, they're gonna stay for surgery, especially breast implants. Those were tricky enough going in. I don't think we're gonna remove any, or at least not the anesthesiologist is gonna remove any. Let's hope not anyway. Okay, that's it. I've got to go pick up my daughter. Oh my God, her room is clean. That's right, her room is clean. Why? Because I cleaned it. Because I spent 6 hours in there on this rainy last Saturday organizing every bead and rubber band and color coordinated her crayons. Yes, I recognize I need medication. I have a problem. I understand that. But the important thing is I feel much better walking past her room. Not really the hallway or the playroom, but her room. So let's hope that we can get the playroom done this weekend, and then I will be complete after, fixing the hallway and maybe having a giant yard sale for the thousands of things I pulled out of her room. Okay, that's it. I got to get out of here. Same as always, face your fears, forget your failures, follow your faith. See you next time.